Hello, Neil O'Neill for ANS Balance. Continuing on our autonomic nervous system treatment, and specifically the neurohormonal axis. So part of that axis is the thymus gland. Treatment of the thymus gland is very important for immunity and coordination of immunity. Also making sure that you don't get inappropriate immune responses. So the thymus is made up of epithelial cells, immature and mature lymphocytes, white blood cells, or immune cells, and fat tissue, but it's brown fat. And that brown fat is hormonally active. It's an endocrine system. So the thymus does change in size with age. In neonates, infants, and toddlers, it's much larger, and then begins to shrink back, never totally going away in adulthood. So in adulthood, lymphocytes travel from bone marrow, so the bones have to function properly, to the thymus, where they mature into T cells. Okay, so the thymus becomes more of a maturation site as opposed to a growth site. That's why the thymus is so large for infants and toddlers, because that's the growth site until their bones are more mature. Okay, so the treatment of the thymus changes as the patient ages. Okay, so there's a picture of the thymus. Now, those are the clavicles on either side. So with the clavicles coming in on either side, what we're really looking at is the manubrium. Okay, so what we want to treat here is the manubrium, and make sure that that manubrium. Now, one of the things I've seen online is there are videos talking about tapotement of the thymus, as if you're trying to wake it up. That's not how the thymus functions. Inflammation causes the thymus not to function appropriately. So instead of tapping, which would actually increase inflammation, you want to decrease the inflammation by deep pressure onto the structure. Then what you want to do is flex down and push the manubrium, right? That's that bone that's in the front here. There's a little pentagonal bone here at the top. If you push that manubrium down, left, right, up, twist left and right, you want to find the position where it starts to feel like it moves the most, like there's the most freedom of motion, and then you want to hold it there. That is releasing inflammation from the bag that the thymus is in. And remember, the thymus functions on releasing its hormones into, and its lymphocytes into the bloodstream. So it's a drainage instead of a glandular. It's not glandular in that it squirts stuff into the bloodstream. It lets it float into the bloodstream, and it has to progress into the bloodstream across out of the organ itself. So you want to make that organ, you want to take the pressure off that organ as much as you can, and that allows those T cells, it gets the inflammation out of there, it allows those T cells to come in, be more appropriately stamped to be functional, and to leave the area, to leave the thymus and go to their functioning areas. Okay, so that's more how your treatment should go. That may take a few minutes. If you have a practitioner that knows how to do that, certainly they could do that and work with T1 through 5. So you could lay on your back on a ball, T1 through 4 or 5, get pressure in the back. You could also sit up against a wall with that, and then do this pressure to get those two parts to the sympathetic nervous system and this system to work together. Okay, there you go.